Welcome to my podcast. Today I'm going to talk about another case that you can face in the clinical setting, and it's common to be seen in a pregnant lady. So after you introduce yourself, as always we agree, double check the patient name, date of birth. The lady will be pregnant within probably a couple of few weeks. And she noted that she started to have itchy rash in her tummy or the belly, and she's in the last couple of weeks of the trimester, the gestation. In the last couple of weeks, and she's otherwise fit and healthy, and she's pregnant with a twin pregnancy, and she notes that the rash started as a few patches, which is erythematous or red within the stria of her tummy, and it started to evolve and extend through the whole abdomen. However, the only peculiar thing that is saving or sparing the very umbilical region. So from that concept, you will have an idea what sort of skin rash that happened in the pregnancy with those kind of description. And apart from that, she's fit and well, and she doesn't have any medication that she takes on a regular basis. She doesn't have any medical condition that she suffers with, no family history with the same thing, no previous history of the previous pregnancy, and she doesn't have any known allergy, and all of the rest is fine. So you will just tell her, do you have any thought what might be the reason for that? And you will ask her if you can have a quick look on her tummy. And you will arrange for certain blood investigation that you might send for, just a routine, just to double check that everything is fine, like for instance, full blood count, urine electrolyte, LFT, coagulation profile, and then you will take it from there. So the first thing you could think of, there is a peculiar eruption that happened in pregnancy, which is called polymorphic eruption of pregnancy, which is denoted like PEP. And it's also known before as diuretic urticaria papulant plaque of pregnancy. This kind of condition is usually self-limiting, and it's a benign condition. There is element of inflammation, and usually it's seen in nulliparous ladies within the third trimester or the last couple of weeks or immediately after having birth. The characteristic feature of this kind of rash, it's extremely diuretic, and it's erythematous, as I said, and it's only seen in the striae of the abdomen, which is the stria gravidarum, of course, and you will notice it around the abdomen. Then it will progress, and it can involve chest, back, legs, but I'm going to spare very umbilical region, which is a characteristic distinctive feature. And the lesion will be polymorphic, which means couple of maybe papule, plaque, vesicle, patch, could be target-like lesion, you just name it. And it occurs in 1 in 150 pregnancy. And the most distinctive part, it happen in nulliparous or primary gravity, but it can happen if the lady had previous gestation before, as the case here. She has previous pregnancy and it was normal. There were no complaint or any skin rash whatsoever. However, the etiology is kind of unknown, and the hypothesis that as the abdomen distended with the growing fetus, the connective tissue will stretch out and will get ruptured and damaged, which will trigger the dermal antigen that will cause the inflammation. That's the theory for this kind of lesion, which cause or trigger the immunological response to the circulating fetus. And diagnosis, as I say, it's quite clinical. And the other differential that you can think of is pemphigoid pregnancy, pemphigoid gestational, which is can mimic this polymorphic eruption of pregnancy. So, in such a situation, and you need to double check and make sure to differentiate. So you might send for skin biopsy, which is simple piece of skin that can be taken by punch. And the other condition that you can think of also like, for instance, certain pregnancy lady, they might have like cholestasis. So this imply that the bile salt is excreted, which can cause intense generalized itching, but it can't be like this condition, which is obviously localized. And there will be scratching mark also in the extremity. And if you send for LFT, you're gonna find it's abnormal with increased bile acid. The other condition you could think of is like, for instance, atopy. So atopic eruption in pregnancy can occur, but it's usually seen in the first couple of weeks rather than the last trimester. And the rash is kind of itchy as well. And it can affect different area of the body, like face, neck, knee, elbow, creases, the typical area of the atopy. And the other one, I mentioned the pemphigoid gestational. So the difference between them, apart from diagnostic biopsy, pemphigoid gestationals will affect the periumbilical region and will cause tense, large blister or bully, which is, of course, completely different from the situation in polymorphic eruption of pregnancy. When it comes to management, so I need to reassure the lady and tell her this is part of the pregnancy. It's expected sometimes to be seen certain lady. There's nothing to worry about, and it's mostly symptomatic treatment. So you're gonna explain that this situation will improve spontaneously since once she has a delivery or give birth, or as I say, it might happen postpartum immediately, so it's gonna take some time just due to hormonal change in the lady. So the only thing you can think of or give is topical strong steroids to alleviate basically the itchiness, because it's quite diuretic. And you could think of certain antihistamines which could help, like clothianine or cetirizine, which is non-sedative. And the other one you can think of like Dixa, chlorpheniramine. However, this is sedative, so you need to draw attention of the lady to this sort of side effect. However, if the case is very severe and it's not responding in that condition, of course, you're gonna give oral or systematic steroid, and of course, you will calculate what's the right dose for this situation, and you will take it from there. So that's in short how you can manage, or once you see those kind of presentation in pregnancy, what sort of thing that you need to think of and differentiate that you could come out with. and how you're gonna manage, of course, after you discuss with the lady and moving forward. Let me know if you have come across any of those kind of cases, and you can write in the comment and I'll come back to you. Thank you.